Hi, my name is Dr. Kerry Tapuzian, and this is Ask Dr. T. Today's question is in regards to male menopause or andropause. Now, what is andropause or male menopause? It's basically decline in testosterone in men over time. It's very similar to what happens with women, but unfortunately or fortunately, it happens over a longer period of time, 10, 20, 30-year period, so it's not as noticeable in men. And let's talk about some of the symptoms, because what most men would think is a symptom would be just low libido. Let's go over here. These are some signs and symptoms that start out with, and one of the main ones is loss of energy, increased fatigue and tiredness, loss of drive and competitive edge. These are a lot of these things that you might not necessarily think of, and you may just associate these with old age, if you will. Loss of mental focus, stiffness and pain in muscles and joints, when you're getting up in the morning. Loss of muscle mass and increased in body fat. Okay. Loss of level of fitness, depression, mood changes, irritability. And last but not least is reduced libido. And as you're going to notice, this is on the bottom too, because a lot of times this is one of the last things to go. You may start having all these signs and symptoms up here, and then lastly it starts with libido. And there's really 4 areas with libido that I'm just going to talk about real quick. Decreased desire and fantasies, decreased morning erections. Someone else should be getting up before you're waking up in the morning. Decreased strength of erection, and decreased intensity of orgasms. All right? Now there's more. So let's just go to the second page just to try to reiterate some of these things. And when I read these, I'm usually thinking about, someone's job and the way that they're performing at the workplace. And these are all things that testosterone actually does, and when there's a decrease in these, it's secondary a lot of times to decrease in testosterone. Initiative, assertiveness, sense of well-being, self-consciousness. Who wouldn't want these things or want to keep having these throughout life? Moods, goal orientation, drive, decisiveness, analytical ability, abstract thinking, and zest for life. Again, all very important things. So far what we've talked about is age, as far as age goes. And normally for someone on the average who's 50 years of age, their testosterone level will be approximately 50% what it was from when they were in their early 20s. When you reach your 70s, your testosterone levels will be about 10% of what it was in your early 20s. Now, there's other things besides just age that will actually drop testosterone levels, and let's talk about some of those too. Okay. Low thyroid function, very important. If your thyroid's not working properly, then your testosterone levels will be low. Very important to get this tested. Stress has a lot to do with it, and we all have stress. So depending on the amount of stress, how you deal with it, it'll have an effect on what your testosterone levels are. The quality of your nutrition. Okay, if you're eating the standard American diet, which stands for SAD, chances are you're not getting good nutrition. You're going to get increased body fat, and with that, you're going to have increased estrogen levels in your body. And estrogen is what most people realize. That's a hormone that women make, but men also make it too, and usually have higher levels the older they get. The amount of exercise is very important that you get, depends on your testosterone levels. Environmental toxins, and then just estrogen levels in general, and we'll talk about this a little bit later as well. Different prescription medications will also lower your testosterone or increase estrogen levels, which has a reverse effect on testosterone. And I'm going to just list a few of the different ones here because they're very common. Antacids, the non-steroidal anti-inflammatory medications like ibuprofen, Motrin, naproxen, antidepressants like Prozac, Effexor, all the different statin drugs, which are the cholesterol-lowering medications, which seems like everybody's on out there. They'll lower your cholesterol levels. Prilosec, or the other medications that are out there for heartburn. And then anything for heart problems or high blood pressure also have a tendency to lower your testosterone too. And unfortunately, alcohol consumption will lower testosterone as well. So these are all different non-age-related items that will lower your testosterone. So how do we test your levels? Well, for the most part, what we'll do is we'll do we'll do blood testing, because besides testosterone, there are other blood tests, approximately a dozen different tests that need to be performed to see what your testosterone levels. A couple of them, just to give you an idea, if this is testosterone, we're going to check your total and your free testosterone levels. But then we also want to check two things. We want to check your estrogen levels, and there's two different tests we do for that. And we're also going to check something called DHT, which stands for dihydrotestosterone, which is actually a stronger form of testosterone. Now, your body naturally makes both of these hormones down here. Your body will take testosterone, it'll make estrogen, and it'll make DHT. And there are enzymes that drive this reaction. And as we get older, these reactions get worse, unfortunately. And so you'll get an increase in estrogen levels as you get older. Now, just as a side note, prostate enlargement, prostate cancer, the biggest problem, or the thing you have to watch out for is estrogen right here. Estrogen, just like in women, it causes growth. And so when you have elevated estrogen levels, you get prostate enlargement, and it's a risk for breast cancer. Not testosterone, okay? Estrogen is the culprit, and that's what you have to look out for. Now, as far as treatment, first thing we'll try is, we'll try a natural approach, if you will, because there are a lot of different nutrients that will stop this reaction from happening down here. And if you have an elevated estrogen level, just by controlling this process right here, you can increase your testosterone by about 10 or 20%. Zinc is very important. Green tea extract, also resveratrol, which comes from the skins of grapes. Those are very helpful for stopping this reaction. There's also a medication on the market. It's called Arimidex, which we'll use in extremely low doses, half a pill twice a week, because it just blocks the enzyme that causes this reaction. And if that's all we need to do with someone, then that's it. We'll do that. The second step that we'll go to is we'll use something called HCG, which is human chorionic gonadotropin. Okay, I'm not talking growth hormone here. This is a completely different animal, if you will. And we'll usually use it in men that are 40s or 50s, because what it does is it actually triggers the family jewels to produce more testosterone. So instead of giving testosterone, you're making your body produce its own. You're kind of going upstream one level. And for the most part, this will work. What you've got to be careful with, and HCG is actually, it's an injection. It's a shot that you give to yourself. It's an extremely small needle, very painless. Yes, very painless, or no pain at all, I should say. But what we do is we do it once a day in very low doses, because the key is not to make estrogen levels go up. As far as other treatments go, as far as using actual testosterone, what we'll do is we'll use it as a cream or transdermal solution. And we'll start out with small amounts and work the way up depending on what's going on in this scenario here. Some physicians out there will use testosterone injections or shots. The problem with that is that when you give a testosterone shot, your levels are going to shoot up really high, and then they're going to come down. You feel great when they're up here, and then you start going through withdrawals when they're coming down here. But the other problem is that when you've got really high testosterone levels up here, a lot of it starts getting channeled down into estrogen, which you don't want, because then you'll start having symptoms of elevated estrogen, which is prostate enlargement, and you also may start to grow breasts, actually. So usually we don't use that type of treatment. There's another type of treatment where they'll actually use pellets that they'll put underneath your skin that will release testosterone over long periods of time. The problems with that kind of treatment that we have found is that you can't control it, and you may get really elevated levels or levels that are too low that may go on for an unknown period of time. So for the most part, we won't do that. Safety, it's very safe to replace testosterone as long as you're monitoring the other hormones and making sure these are staying at normal levels. There are some side effects also. Your blood can become thick, especially if your levels become too high. The treatment for that is you donate blood. But for the most part, there aren't many side effects, if you will. So is this holistic? alternative medicine, or does this sound more like common sense medicine? My name's Dr. Kerry Topouzian, and this is Ask Dr. T.